The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
I guess this is a review question, something we covered in the very beginning, but why do injection therapies, or why are they more effective than oral meds when they don't work?
Yeah, that's an excellent question. It's very important to reiterate why that's the case. So one of the challenges, remember that you're kind of fixed on the maximum dose that comes into the oral medications, 20 milligrams Cialis, 100 milligrams Viagra, for example, or their generic forms, and that's it. And some people need more than that. And that's where the injections come in, because you're going to be able to deliver the medication in liquid form at a higher dose and put it exactly where it needs to go. The second thing is that when you are taking these medications by mouth, right, you have to worry about the timing. Sometimes you have to worry about whether you're having it with food, because even though you swallow it, it may not be accessible into your body downstream 1 or 2 or 3 hours later. So the benefit of injections is that you can bypass the whole ingestion process and be able to inject the medication directly into the penis when you want. The other thing is going to be, remember that the time of action is also much faster than oral medicines. The needles typically take about 10, 15, 20 minutes for them to work, so much more quick than the traditional oral medications.
Certainly. Great review there. So next question here. Do you lose any sexual sensation when erect with the injectable medications?
You don't. The injectable medication is simply just giving you an erection, and that's it. So your ability to have that sexual feeling, your ability to orgasm, and your ability to ejaculate are all going to be maintained. In addition to that, after you have your sexual activity, the having had performed an injection into your penis is not going to change your ability to urinate. All of that is going to be the same. The injection is simply a means to be able to make your penis firm.
Certainly. Next question here. Can penile injections also help the length of the penis just besides the erection?
So that's a good question. Performing injections does not increase or decrease the length of the penis. The injection simply just makes the penis hard. For many patients who have experienced erectile dysfunction, depending on what the etiology of your erectile dysfunction was, or even how long you might have had erectile dysfunction for, those are the reasons why you might notice some change in the length that you've experienced. However, once again, the injections do not shorten, nor do they increase the length of your penis. They're simply just making your penis firm.
Alrighty, perfect. Next question here. How many times can you inject in a normal week? And then I think the follow-up is going to be, can you inject twice in a row, so in one session?
Sure. It is best not to inject twice in a row. And that's the kind of what I iterate to my patients in terms of just being patient once you first start learning this. Yeah, you're going to have some duds, and that's part of the learning process. But it's safer to have a dud than to go to the emergency room with an erection that lasts too long. Once again, even though the medication can take maybe 10, 15, 20 minutes to work, it's possible that for somebody else, it may take 30 minutes to work. And if you're impatient and you double the dose and give yourself 2 injections in a short period of time, that may be too much medicine. You may be in trouble and you may need to go to the emergency room. In terms of how frequent you can perform the injections, The general recommendation that most people give their patients is about 3 to 4 times a week.
Next question here. Are the corpora cavernosa interconnected? The follow-up to that is, does an injection on one side diffuse somehow to the other side as well?
Excellent question. So even though you have one penis, your penis is actually like a double-barrel shotgun. So there are 2 chambers within the penis, and those chambers are what we call corpora. You have one on the left side and you have one on the right side, and there is a septum in which the blood and chemicals or drugs can go back from the left side to the right side to the left side to the right side. So they do communicate. That's why performing the injection on the right side can make both sides of the penis hard. And that's also why we recommend also injecting on the alternate side or other side once you get the hang of things, so that because they do communicate, you'll be able to deliver the medication into the penis successfully. So it doesn't matter which side you are injecting into, it will work in both chambers since they communicate.
Alrighty, perfect. We're gonna jump into some injection techniques and troubleshooting here. So please address a painful injection and what to do when someone experiences this. I've seen it a couple times pop up.
Right. So it's important to understand what the person means by painful injection. If it is, it needs to be, the question needs to be further clarified as to, is it the injection itself that's uncomfortable, meaning is putting the needle into the penis uncomfortable? And the answer to that is yes, you will. It's not going to be painful, but you're going to feel that something is put in, just like a shot on your arm. For most of my patients, when we learn how to do this in the clinic, most of them say, hey, that wasn't that bad. I thought it was going to be a lot worse than that. I can do this. So it's really a lot better than you think it's going to be. That feeling or that sensation, though, is going to be there. And so maybe sometimes using an auto-injector might make the injection quick enough that perhaps you don't feel it as much. However, what most people are talking about when they do injections is that they can actually have pain in the penis. And that commonly, or I'm sorry, not commonly, but that infrequently can occur, most commonly because of the medication or one of the medications in Trimix. So for some patients, they get a sore penis or achy penis when they use Trimix, for example. And therefore, rather than stopping injections, the better course is maybe to even try Bimix to see whether that can help them with their erections without pain.
Next question. When I withdraw the syringe from the penis, sometimes the needle is bent. Why may this happen?
Sure. I can think of 2 ways or reasons why this may happen. Number one is there are different needle lengths and there are different needle thickness. Even though you may think that you want the thinnest one or the shortest one, based on your penis anatomy, the thickness of your skin or whatnot, you may be better served with a slightly thicker or longer needle to help you to be able to enter in your penis more effectively. One other tip is that the more you puncture something with your needle, the more the needle will dull. So, for example, when you're using the vial and the rubber thing, you really only want to stick this once. You have to stick it at least once, but you don't want to repetitively stick it. Otherwise, that needle is going to dull. And then when you try to put it in your penis, it's not going to be as sharp. In terms of technique-wise, if you're following the right technique and putting the needle in slowly with strong pressure, that will help the needle also not to bend. I do think that some people who experience bending in the needle may be trying to put it in too quickly and perhaps at an angle, and therefore that tip of the needle can bend. But if you do the injections slowly and deliberately in a controlled way. That should help to minimize any bending of the needle.
Alrighty, perfect. We have a follow-up to a question we asked a few questions back, but what if you'd like to have sex more than 3 to 4 times a week and you're on an ICI treatment plan?
Those are things that you can talk individually with your provider about kind of the frequency of the activity that you're having. Those would be more kind of like off-label use, and you can ask your provider to see how they feel.
Perfect. Alrighty. Next question here, a little more on the general side. What is the difference between Bimix and Trimix?
Once again, bi meaning 2 and tri meaning 3. We're simply just talking about the number of drugs that are actually in that concoction. So in general, most people who are on injections are going to be started on a Trimix medication. But once again, that medication of the Trimix may be too strong for that person. They're in between that window where Viagra doesn't work, Trimix is too strong, so they go to the Bimix as an alternative.
All right, perfect. Next question here. This person says they already have a penile curve and are wondering if injecting on the bend can help straighten this out.
So I would say that for patients who already have a curve, there is a specific treatment that exists, which is kind of for a separate conversation, in which a special type of medication is injected into the scar tissue to help break it down to reduce the curve. However, we don't have any information about whether just performing an injection into the area will help to reduce the curve. So what I would recommend, if someone had a particular interest in learning more about that or having that particular question, talking with their provider and having a direct conversation to learn specifically to get an answer about that. But that is not something that I would typically encourage someone to do or say that we have data to support use of the needle for injections in that manner.
Perfect. Alrighty, next question here. Is it okay to inject into scar tissue? And I guess if someone already has some scar tissue, what are some methods for still using the treatment method?
Right. If you're concerned that you have scar tissue, most of the time that scar tissue in general, but not for everyone, is going to be on the top side of the penis for most patients with scar tissue or Peyronie's disease. Based on that, remember, you're not doing your injection at 12 o'clock. Most of the time you're doing your injection at 10 o'clock or so. So even though you may have a scar tissue or a plaque on the top of the penis, most people are going to be able to inject on the side of that or away from that pretty easily. If you have some curve, then please review your anatomy with your provider, and they'll be able to perform an exam and give you some more detailed tips that will apply directly to your case.
Certainly. So next question here. I've seen this quite a few times, so maybe if you could hold up the little prop there and show us where to inject on the penis, on the side of the penis. It seems like that could be helpful to see that one more time.
Yep. Remember, it's helpful to pull the penis on traction. That helps to give more length to the penis and more turgor to the penis so that you can put the needle in successfully. If your penis is collapsed or bent, then it's not easy to perform the injection. So remember to retract your foreskin, pull your penis out so that you can get some nice turgor to the penis. Once again, 12 o'clock is not where you want to perform the injections. On the bottom side at 6 o'clock is not where you want to perform the injections. You really want to perform that injection at around that 9 to 10 o'clock position. I'll just demonstrate that to you again with the needle here. This is 9 o'clock. So this is going to be 9 to 10. I'm coming in perpendicular to the penis and entering all the way in. From the opposite side, this is 3 o'clock, for example. That's a little bit, for some patients, too low. So we're going to come around at 2 o'clock in a perpendicular way and go directly into the side of the penis. Remember, you don't want to inject into the exact same area of the penis, so please move along the length of the penis during your injection journey. And once you get good, please hop to the opposite side and continue to do the injections on the opposite side.
Perfect. Thank you very much. Alrighty, next question here. Please talk about using ICI with VEDs. Is this something you recommend, and in which order should this be done?
I think if you have a vacuum erection device, it's perfectly fine to use that with a penile injection. I personally try to get my patients to learn how to adjust the dose appropriately so they can eventually get rid of the VED or vacuum erection device. I kind of recommend and prefer my patients just to predominantly use the VED at the beginning, those first 5 to 6 times when they're learning how to use the medicine, because they don't want that to be a completely wasted moment. So if you have a VED and you got a 6 out of 10 erection with the injection, you could go ahead and use the VED to be able to get that 8 out of 10 erection that you're looking for and make that a pleasurable night. However, once again, once you get the right dosing, the goal is, at least in my view, is to be able to stop using the VED so that you don't need it for regular activity.
Alrighty, thank you very much. Next question here. If intraurethral gel only works so-so for me, would you expect better results with Trimix?
I would expect that you have better results with Trimix versus the gel. The problem with the gel is once you enter it into the penis, even though you close the tip of the penis, what happens? As soon as you let go, all the gel comes out. So because of that, you're losing some of the efficacy of the gel. It doesn't all just stay in the urethra. The benefit of doing the injections is that you're going to be able to put it into the penis and it's not going to like leak out. You've injected into the meat of the penis, so you're going to be successful with that. The other challenge with the gels is that there are, say for example, the compounding pharmacy that I use, they only have 2 formulations of the gel. So if you don't meet that, then there's nothing else that you can do. With the injections, as you've seen with MenMD, they have many, many formulations that exist. And you can continue to change the concentration to a higher concentration or inject more if you're not achieving the results that you're looking for.
Alrighty. Next question here. Sometimes the medicine is not injected into the corpus cavernosa and ends up under my skin. Is this dangerous or harmful other than the pain that this causes?
It is not harmful and it's not dangerous, but it also didn't work. So that's where injection technique is important. And that's where understanding the anatomy of the penis is also important. Because if you put it under the skin, it's not going where it needs to go. It needs to go beyond, past the skin, into the meat of the penis, which we call the corpora.
Alrighty. Next question here. Should you push air into the vial prior to sucking out the medication? I think that's before drawing it up into the vial during the beginning process.
Mm-hmm. Right. It is beneficial to have a little bit of air before, as you're drawing it up. Number one, it helps you to just, have a guide as to what am I aiming for when I'm actually loading the medicine. So it gets you focused. That's number one. Number two is that it also helps to allow the medication to enter into the syringe as like a vacuum as well. And if you have too much medication or an air bubble, you can go ahead and get rid of it and push it back into the vial. That way you don't waste your medicine either.
Alrighty. Next question here. Saw this one a couple times. Why do I have to increase the strength of the meds? And what is, I guess, the max strength? But that probably varies.
Yes. So you have to adjust the dose of the medicine because we don't know exactly what you are looking for. What I mean by that is everyone has a different degree of erectile dysfunction, and everyone has a different sexual goal. Some people are looking for an erection that's just firm enough for masturbation, and they need it to last for 10 minutes, and that's all. That person's needs is very different than somebody who wants to have penetrative sex for 30 to 45 minutes. So remember, you adjust the dose of the medication, not just for the firmness, but also for the duration that the medication is going to last for. And those are some of the principles as to why you need to adjust the dose. Thank you all for joining us today, and I hope you found it informative. Once again, I just want to reiterate that sometimes having a journey of erectile dysfunction is not the easiest thing. Not all providers are passionate about it. Not all providers are knowledgeable about it. And if you are looking for somebody who would be happy and excited to help treat you during your journey, I would be happy to do so. You can contact our men's health office at the phone number below if you're interested, and our team would be happy to help arrange a visit for you to come see us in person to find out how we can help you along your journey.
If you'd like to learn more about injection therapy, you do have a few options. There will also be more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. You can also call MenMD at 857-233-5837, or if you'd like to get your question answered, you can log into the MenMD portal to schedule an appointment with a personal health assistant. If you're interested in any of the injection accessories that you learned about tonight on the webinar, you can purchase these accessories on the shop page on menmd.com. I'd like to thank everyone again for attending tonight's webinar, and we hope to see you at the next one.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.